Right, good morning, everybody. And as I said earlier, I hope some of you have got, or all of you have got a glass of water. I just recommend that in the heat of the day, depending on where you are. So before we get going on the event, I'll just introduce myself. So my name is Kamini Gautok and I'm Chief Executive at the Royal College of Speech and Language Therapists. It's wonderful to have so many of you join us on this call today. I'm just going to go through some housekeeping. So if you could go to the next slide, that would be great. Thank you. So I think I said to some of you while you were coming into the main room, do make sure that on your Zoom screen that you have your name. It's sort of your virtual delegate badge, so to speak. Do use the chat function if you want to ask any questions, if you've got any issues, and the events team, Rebecca and Jazz in particular, are on hand to help you. If you want to keep your camera on, please do so. And if you need to pop out for any reason, do feel free to do that and rejoin. If it's easier for you just to put your camera off and put yourself on mute, if you need to do anything, also do feel free to do that, particularly over the break, so you don't feel stressed trying to get back in. So I know I find that a bit of an easier way of handling things. If you have any specific needs in terms of accessing the information that you're hearing, then again, please do get in touch with Rebecca or Jasmine. And just to say, at the end of the day, we will have an evaluation form, which I'll remind you about. It's really important that we get your feedback, because this is for us to really see how we can do this in a different way in the future. So if we go on to the next slide, just in terms of scene setting, obviously, hopefully many of you are very aware of the situation, and that's why you're here today, is that we know that the profession as a whole is experiencing huge pressures, and specifically within children's services, things have really escalated during COVID and post, while we're in the COVID recovery phase. So we're really keen to be here to listen to where you are now, to hear about your experiences and the current challenges, as well as some of your achievements, and we hope that you will be able to share those too. We know that we don't all have the answers, but we're hoping that between us we'll be able to work together to try and identify solutions as we go forward in meeting the needs of our children and young people. So this is a UK-wide event, so we know the challenges are different across the UK, and it's really important that we hear and learn from each other, and also think about how we can really look at some of the solutions that might be things that we haven't trialed before, things that might have come up as a result of doing things differently through the pandemic, or not, or as a result of the recovery process. So very much about joint working. Okay, so before we get started, we'll just want to talk through some guiding principles. Oh, sorry, resources, RCSLT resources. I did ask for this slide to go, and then I've forgotten about it. So we've just wanted to draw your attention to resources that are already on the RCSLT website that will help you. And I'm going to remind you of these again at the end of the session today. So if you're not aware, and you may not be because you've been incredibly busy, I know, we have got a lot of resources that will support you in looking at how you deliver high quality care. That includes evidence-based practice resources. We have a document called Placing Children and Young People at the Heart of Delivering Quality Speech Language Therapy. And there's some webinars that accompany that guidance for you to watch, which is very much about how we co-produce outcomes that are important for children, young people and families themselves. If you're not using any outcome measure tools, then you might be interested in looking at the root guidance, which as well as collecting data on individual patients, we also have guidance on how you measure outcomes outside individualized care, so more of the public health role that you might be playing. And more recently, we've published a health inequalities self-audit tool. We know that health inequalities have increased, particularly because of the pandemic, and we're very keen for you to start looking at how you can address some of the issues, some of which again may have been long-standing, and some which may be new. We have other information on the website, including a statement on the recovery and restoration of children's services, and guidance around SEND in England and in Wales. And in England, we've also just published some information on the newly developing integrated care systems, which are going live very soon. So if you're not involved in integrated care systems, please do read that if you're in England. Thank you so much. So next slide, please, Jasmine. The guiding principles for today, I'm sure you're going to be brilliant at this. It's really important that we spend time listening to each other, sharing ideas. This is a safe space, so very important that we can empathise and support each other and be inclusive, so allowing everyone to have an opportunity to speak. So I'm pretty sure that you'll be brilliant at that, and hopefully we'll make enough space and time for you to do that. So thank you again for listening to those guiding principles. So I'm going to move us on. So we're just going to move on into the first session, which is really, this first session is about listening to you. And during the registration, we asked you to tell us what the biggest challenges are that you're facing in the service, and the breakout rooms have been created based on this information. So we're going to put you into these breakout groups, or you can choose which ones you want to go to, and you'll have 20 minutes to discuss in detail with colleagues what specific challenges you're facing. And then later on, after this session, we're going to have another breakout room later, which will then look at solutions. We're very aware that during this conversation, some of you may well come up with solutions, and we'll ask you to put them to one side and revisit them later on. So don't worry about that. We'll make sure that we don't lose those. What's really important, though, so that we don't lose the conversation, is that we have a nominated scribe. We have a facilitator, as you can see, for each of the breakout rooms, and we've got a Google Doc that we'll be able to share with you so that you can take notes. So if you can start thinking about whether you're happy to take notes, as well as making sure you contribute, that would be great. We will have a feedback session, but we've got limited time for that because we want to spend more time for you to discuss issues in detail. So from this breakout session, if you could consider 1 or 2 key things that you'd like to feedback, we'd be very grateful, because you'll have about a minute per group. Okay, so I hope that's clear. So 20 minutes across these different areas, so you can have a look at the screen. Yes, we have got some, 1 and 2 are the same. So because of the number of people, there's more than 1 breakout group for some of the topic areas. If there are too many people in one group and less in another, we'll move you around. Yeah. Hi everybody. Wow, that was an amazing session. Thank you so much for sharing all your challenges, and lots of, I think, commonality, certainly in our group, which was room 1. So I'll kick off on the feedback because I know we don't have much time, but I think there was in terms of commonality, it was very much around the concerns that huge caseloads are being normalised, but as a result of that, whilst wellbeing is seen as an issue for staff, it's very hard to meet the needs of staff when what they're also being pushed to do is deliver poor quality care. And that was another concern that everybody's aware of, that service delivery and evidence-based practices is not what it should be, and wasn't that pre-pandemic either. I think that was the key messages. There were quite a few others that obviously we'll review during this process. So shall I go to room 2, breakout room 2? Who's going to feed back from breakout room 2?
Thank you, Kamini. I'm feeding back on this one. I think one of the things that was noted was RTT and the figures that people are asked to be reporting on, and the KPIs, and that everybody knows that that's just a one point in time that you're there for, showing whether it's 18 weeks. 44 weeks, 52 weeks, but then there's a different weight again for follow-up, and that being a real concern, and that there isn't an appreciation of that. Just one thing that I want to say contributing to that infection prevention and control are still stopping people from doing groups. So whereas that would have been something that was delivered prior to the pandemic, not possible at the moment.
Okay, that's interesting. So sorry, I should have said group 1 was looking at workload, and I assume, Pippa, yours was looking at waiting lists. Is that right?
Workload
as well. All right.
We're looking at workforce, and one of the themes that came up was that over the last 8 to 10 years, in many places, there's been a gradual reduction in the number of people applying. And while it used to be relatively straightforward to apply to, to get applicants to their higher bands, in some cases, even bands 6, 7 and 8A posts, they're getting few or no applicants. So definitely a theme over many years, but exacerbated in the last couple of years with a general theme that people are moving to independent practice, that there are much bigger independent practices now with supervision and CPD structures in place, so that makes it more appealing for newly qualified therapists. And then some innovative solutions just touched on things like recruiting directly from the university, so going and interviewing students. But there was another theme there, which was that the students who've been through in the last couple of years, in many cases just have huge gaps in their knowledge and experience, and often limited insight into what those gaps are, which was identified as a real challenge for people trying to recruit. So I think that summarises most. There was a very rich discussion, so do pitch in if there's anything else, Glenn.
Oh, thanks so much, Catherine. And before I forget, we did have a webinar this week on supporting newly qualified practitioners. So if you've missed it, it'll be going onto our website fairly soon. And we were again coming up with ideas for how to support NQPs in that space. So room 4, if I could just go to room 4, and if you could say which your topic area was and your key bits of feedback. Thank you.
Thank you, Camilla. Yes, I'm going to feed back for our room 4. It was the same as room 3, so it was workforce, and we just echo all the things that have just been said there. But we'd add again this competing. It was definitely a big thing of competing with private practice, and even for taking band 5s, they're much bigger, as Catherine has just said, and they're able to give more time. You know, getting the competencies is difficult in the NHS services, but sometimes it can offer a better salary as well, and more perks, work-life balance, but all the issues, that Catherine has already said.
Thanks very much. So go on to the next group. Is that group 5? I've now lost count.
It's group 5, and that's me feeding back, and we were discussing complexity of needs. There were a couple of us in the group, but we were in agreement. We've seen with home learning a lack of socialisation and stimulation, and that's had an impact on some of the children. So you can see a real disparity between the group which have had the stimulation and those which haven't. We've got an increase in mental health needs and conditions related to these. So we're seeing an increase in children with SM, increase of children with stammering, increase with children with ASD and SEMH or anxiety, an increase in school refusers. And we're also seeing, whether it's related to the pandemic or not, an increase in children with nonverbal ASD coming into our mainstream schools at the start of reception. So that obviously has an impact on our staff training needs. And in some cases, they're few and far between, but we're also getting referrals for conditions related to post-COVID syndromes. So that might be affecting voice or swallowing. Yeah.
Okay, thank you, Jennifer. Group 6, your topic area and feedback, please.
Our topic, Ruth, you go ahead.
Yeah, we were looking at HCPs, so I'm just going to give some brief feedback. Actually, what was quite therapeutic, I think, was that we were all saying that we had very similar challenges in terms of increased demands for HCP assessments, often with very short timescales, hard to juggle those alongside the other work, bearing in mind waiting times and waiting lists for news and for more regular review therapy. Some areas have got some joint commissioning between local authority and the CCG to specifically target tribunals and conflict resolution with families and parents. And that has had, hopefully it will have a positive impact on the well-being of the rest of the workforce, because staff have been finding that really, really difficult. And I think the other thing was just to say that I think across the board, we're all saying that it's sometimes challenging looking at some of the advice that comes from some of the independent therapists in terms of what is advised on the HCPs. So that's probably the highlights. Thank you.
Lovely, and lovely to see you, Ruth. Yeah, that's great. Okay, thanks for that feedback. So have we got one more room left? Is it room 7?
Yeah, that's me. So staff wellbeing and resilience. The interlinked challenge we identified was, first of all, the pressure of workload and waiting lists and waiting times and the sheer volume of work. That linked to exhaustion post-pandemic. And then allied to that, as well as exhaustion, colleagues' feeling of stress, colleagues' feeling of guilt around not being able to meet the waiting lists and times, but then interlinking the well-being support and initiatives, people not being able to accept them because they're just not in that place, and because they feel like it's a distraction from the waiting lists and waiting time, which is support.
Okay, so a lot of common themes, and there's a lot of interlinkage, we know, around these areas. So we're going to have a break in a minute, and when we come back, we're going to be hearing from some speakers about some of the innovative solutions they've tried, and then you're going to have another workshop session which will be very much focusing on looking at solutions, because that's what we want to work on with you. And as I said at the beginning, we know that none of us have the exact answer, and it's really hard, but we want to work with you to come up with a plan that we can support you with at a local level. So I'm going to let you go and have your break for 10 minutes. Do just turn off your camera and put yourselves on mute so you can get a 10-minute stretch of legs, and we'll see you in 10 minutes. Thanks very much. Hello. I hope that most of you are now back in the room, and I'm going to get us to move on to the next part of this session, which is getting, having the opportunity to hear of examples and ideas and innovations from across the UK. So this slide gives you an overview of who's going to be speaking. So I want to start by introducing Louisa Maguire, who's the coordinator for children and young people speech language therapy services in NHS Forth Valley. So these are examples from across the UK. So Louisa, over to you.
Morning. So thanks for that. Yes, I work in Scotland, so I know things are slightly different here. I'll just take you through some of the things we've been trying over the last couple of years. So working in Forth Valley, it does cover 3 council areas. Do you want to move on the next slide for me, Jazz? Thank you. So we do cover Falkirk, Stirling and Clackmannanshire. And we have an estimated population of around 64,000 children and young people, and probably about 15,000 to 16,000 of those are predicted to have speech, language and communication needs. And we've got about 41.3 whole-time equivalent staff at present. So next slide. So we reached a point in 2019 where we knew we needed to make a change to our service delivery model. It was no longer okay to carry on with a traditional refer, assess, treat model, as that wasn't going to achieve the wellbeing outcomes we needed for our population if we were going to interrupt the intergenerational cycle of poverty and deprivation, and if we wanted to enable people to take responsibility for the wellbeing outcomes that they wanted for themselves. So next slide. And we knew that if we stayed working at individualised care, we would only meet the needs of about 10% of the population who had predicted speech, language and communication needs. So next slide. So we used Ready to Act as a key driver, which is a Scottish Government plan for children and young people who require support from AHP services. And we wanted to ensure that those closest to children and young people are enabled to use practitioner knowledge as and when needed to maximum benefit. And we wanted to ensure that expertise is available as far upstream as possible to meet the needs of young people and those closest to them. And we knew that true intervention was no longer a nice to have, it was a must if we were going to meet the needs of all the children and young people. So this meant that we had to, creatively disrupt the processes and the systems that we had become wedded to. And we had to change the conversation from what's wrong to what's important to you, so that the people's perceptions of their own well-being were at the centre of our outcomes. Next slide. So in 2019, we completed our transformational review of our service, and we took the time to stop and listen to families and our partners in education and health and to ask them what was important, and we co-produced solutions. And this ensured that our transformational change ideas were driven by the needs and the views of the local population. So the process aimed to answer the fundamental question of what do children with communication needs require in order to be safe, healthy, achieving, nurtured, active, respected, responsible and included. Next slide, please. So in order to truly deliver positive and sustainable outcomes for children, we learned that communities required a whole systems approach that included quality approaches across universal, targeted and individualised levels, and across the 5 strands of family support, environment, workforce, identification and intervention. So next slide. So our service worked in partnership with Better Communication, and now we implement the balance system framework to underpin our offer. Next slide. So having completed our understand phase, we're ready to implement small tests of change, and then the pandemic hit. And that just turned everything on its head, as I'm sure you can all relate to. And it led to a significant impact on caseload, throughput, workload, workforce, staff wellbeing, all the things we've been talking about this morning. So we had to work hard. We had already worked really hard in the service and developing a really healthy culture, but that foundation was really destabilised when COVID hit. So next slide. So pre-pandemic, our caseload had typically sat around 1,200 children and young people, and we typically admitted as many as we discharged, so our throughput was balanced. But what we found in the months after March 20 was that our caseloads began to rise, and by late 2021, our caseload had reached about 1,800 children. And it wasn't the number of new requests that was actually increasing, although it did feel like that. It was actually our rate of discharge that had changed. So from August 20, we discharged less than we admitted, and this meant we no longer had throughput and our caseloads began to grow. At the same time, we experienced about 25% reduction in our workforce. So there was significant pressure, around the workload, workforce wellbeing. And I think faced with this pressure, the staff group wavered, and it was tempting to consider things like, well, let's just stop doing universal and targeted and focus on individualised care. Or we need more resource, so let's show this by letting our waiting lists grow, and maybe we'll get some waiting list initiative money and more resource. Or let's just discharge everyone on the caseload because we don't have capacity to see them anyway. Or why don't we prioritise the early years and not see all the children? And whilst all these ideas might have helped the work of the service, they weren't going to work for the children and young people. So I really feel that as leaders, we have got to hold that demand and hold that pressure for our staff, but keep a focus on what do we need to do better, so we can focus on what families and children and young people need from us. So next slide. So I think as we recover from the pandemic, we need to make brave and wide-reaching decisions to support sustainable workloads. And this needs to be in collaboration with staff and stakeholders. So we need to keep a focus on prioritise resources upstream and prioritising early intervention, prevention and self-management, and promoting least intrusive interventions that are directly linked to wellbeing outcomes, and it's in collaboration and without the need for a referral to a specialist service. So we can't be drawn back to that refer, assess, treat system, and by that focus on individualised care. So this is requiring us to engage, consider how we engage with our new requests into the service, with a really strong focus on self-management and building capacity within families and placements and communities. So we're continuing to focus on delivering universal and targeted alongside individualised levels, and we're only stepping into individualised care when needs can't be met at a universal or targeted level, and providing support for staff to make these clinical decisions. So next slide, please. So as we've increased our early intervention and prevention offers, and as we've changed the conversations at the point of request for help, fewer children are required to be stepped into individualised level services. So with effective decision making at the point of request for help, we're seeing about 50% of our requests can be managed with reassurance or advice, and then they're not being stepped into individualised care. And I really feel that to solve waiting lists, we need to offer more universal and targeted, as the vast majority of children will have their needs met at this level and therefore won't need to be on a waiting list. Next slide, please. So I'm pleased to say that we now have a very definite downward trend in our caseloads, and that is creating capacity for more universal and targeted offers. And I think it's been really important for staff to remember that we are specialists when working at all 3 levels, so universal, targeted and individualised. And we need to make sure that those closest to children and young people are enabled to use that specialist knowledge as and when needed to maximum benefit. And we need to make sure that something's happening every day for children and young people with speech language communication needs in their context. And next slide, please. So I would say kind of top tips if you're thinking about your own change journey. I think you have to intentionally focus on a healthy culture at work. You've got to start with the hearts and minds and bring people on the journey with you. Engage early with your stakeholders. Know what your baselines are. So what's your baseline of your current offers, your caseload, your workforce data? Understand your demographics. And then I think it's really important to change the outcome of referrals and move from being reactionary to proactive. And then the final slide, please, Jasmine. It's the quickest 5 minutes ever. I'd just like to leave with this quote from Elizabeth Gregory, as I recognise that when we're under significant pressure, the temptation is to snap back to a place of safety. However, we can't snap shut. We need to stay open to innovation for the children and young people of today and also the parents of tomorrow. So that's it from me, and I'm going to hand over to Deirdre.
Thank you, Louisa. Hi, my name is Deirdre Lavery, Head of Service for Speech and Language Therapy in the Northern Trust in Northern Ireland. We have worked together with our AHP colleagues to develop a project looking at focusing on working together to communicate better with our service users. Back in 2016, sorry, next slide, please. Back in 2016, a service user survey highlighted that there were frustrations, gaps and inconsistencies in the communication that children and their families received when accessing AHP services in the Trust. And this included right from the beginning of their journey, pre-referral, right through to intervention, review contacts, discharge and post-discharge. The project used engagement with families and staff through workshops and focus groups to try and better understand the communication that families wanted. So 3 work streams were families as members were set up to produce the outcomes identified. So we wanted improved pre-referral and referral information for all AHP services and consistently throughout onto the NHS-CT website. Consistent written information across AHP services, and that includes leaflets, appointment letters, episode plans, care plans, and having an agreed template for those. And also offering a choice of follow-up appointments to support families throughout their journey. And that included face-to-face, telephone and digital. This was pre-COVID, but obviously when COVID hit, the digital and remote access became essential to the communication. We also aim to develop a communication toolkit to provide principles of communication that should be included at each therapy contact, a sort of communication pathway. This transformational project has worked in partnership with families to improve communication for children and families accessing AHP services in the Trust. Next slide, please. So why this project was and is important? Within the Trust, we had experienced a growing number of educational tribunals and formal complaints challenging paediatric therapy services and the provision, which led to AHP service leads setting up a task group to explore families' views. This task group involved nominated members from all AHP services in the Trust. Initially, the service user survey was developed, and these were given out across a 2-week period throughout all AHP clinics and through domiciliary contacts. And it was hoped that the survey would highlight any areas of misunderstanding around therapy. 249 families responded to this survey, and the main results were that families wanted access to pre-referral and on-referral information. The survey results indicated only 22% had pre-referral information. Families also indicated they wanted to be involved in the decision-making around their child's therapy. 72% felt they were involved in any changes to their child's therapy, but only 43% of families felt involved in the decisions to discharge or complete therapy. So from this survey, 3 focus groups were set up across the Trust to explore in depth with families their perspectives on the communication. This was advertised locally and families were identified to work alongside the project team. And the 2 workshops were then held with staff across AHP services and families. And these in-depth discussions further identified the need to provide consistent written information across LHCP services and to offer more choice in how therapy was delivered. Next slide, please. Okay, the survey highlighted, we got descriptive information from families as to how they wanted communication to be with them throughout their journey. So what we did was we got some comments from the families, and as you can see here on this slide, lots of families wanted more guidance on things that they could do with their child. So they wanted to be the ones in control, helping support their children within their home environment. Some parents told us they would like to receive what is expected. Some parents came with a preconceived idea of what they felt therapy should be. And that's where the communication comes in very, very clearly, that we need to understand any preconceived ideas and then have conversations to see exactly what reality is going to mean for their child and their family. We also had parents saying they would like a phone call to see how therapy is going. When families were attending with their children in clinic, they felt they couldn't give enough time and concentration to listen to the therapist because they were managing their child. So therefore they felt a follow-up call in the evening would have been appreciated. They wanted us to explain the benefits of therapy and just really to identify how they could help their child. So the baseline information was descriptive and qualitative. It identified that families needed more information both prior to and on referral. It also identified that families did not all feel involved in the therapy journey and only a minority were involved in discharge. So this definitely necessitated the development of a communication toolkit to ensure that conversations were consistent and were taking place at each contact. A process map and driver diagram were completed based on this for project planning. Next slide, please. So from this survey and from the focus groups and the workshops, we developed 3 outcomes. Outcome 1 was looking at pre-referral and referral information accessible on the NHS-CT website. Website development was based on scoping across AHP services regionally and with work through the Northern Trust corporate communications team. Families and staff identified what information they wanted to access, and this was developed in conjunction with their input and consultation with paediatric AHP services. Outcome 2, consistent information provided in writing by HP services and in care planning. Information was produced collaboratively across AHP services, a template for service information leaflets, agreed communication process around letters and guidelines with NHS and Northern Trust letter systems, and an agreed care plan template for families to support their therapy journey. And number 3, the communication toolkit to support AHP and family communication. The toolkit was produced with families and staff to support each contact with principles identified and questions that could be used as a script for therapists. Training took place with identified communication champions across AHP services, with the toolkit forming part of the student and new staff induction and training and auditing through the AHP case supervision. Next slide, please. The impact of the project. Co-production was work to ensure that the right information is provided at the right time in the right way. There's a wealth of information and knowledge that was gained through the survey. The focus on the website development, implementation of new resources, and embedding the communication principles in all aspects of clinical work. Service users continue to be central to the review and update of the communication principles and toolkit to help ask the right questions at the right time to support the delivery of an effective, timely service to support our families. Communication champions are trained to support staff teams, and feedback has influenced the communication toolkit and principles update. The communication approach could be influential across trusts. The project's ongoing direction may provide the opportunity for transfer and dissemination of learning regionally for AHPs working with families. And there is discussion with the Clinical Education Centre, which provides regional CPD for SLTs, to incorporate the communication principles toolkit into a communication training strategy to support the AHP workforce across the region. Next slide, please. The learning co-production worked to ensure the right information is provided at the right time in the right way, but it's challenging To support this, we offered focus groups, one-to-one sessions and group sessions at different times and days to accommodate service user involvement. Understanding the needs of our parents and their ability to commit to meetings was paramount. Timing of staff and service user involvement was challenging due to workload, work and family commitments. So if we repeated this, realistic deadlines should be set and ensure that all involved have the right information and support. Communication toolkit and principles form part of everyday conversations with families and AHP services in the Northern Trust. It is transferable across services trust, undergraduate AHPs, and will form part of a regional communication strategy. Throughout COVID, the toolkit and the principles have been central to maintaining the communication with our parents. It is anticipated that the survey will be repeated, but anecdotally, from compliments that we have received, parents are now feeling more informed in the decision-making around their child's therapy, including discharge. And moving forward, we will continue to review and update the communication pathway and toolkit in collaboration with our service users. I will now pass over to Pippa for the video.
Hello. I want to talk about an approach used in my area by the Speech and Language Therapy Service to meet a demand. This came about as schools raised concerns about children's speech, language and communication skills, as well as their fine motor skills, after a period when schools were closed due to COVID restrictions. A 1-hour session on Teams by 2 speech and language therapists was held with additional learning needs coordinators from primary schools in the area. Some of the organisation that was required for this included circulating a flyer with details about the session, and we sent out the invitations separately to the flyer. The flyer invited additional learning needs coordinators to send in questions in advance. The commitment on the day from the speech and language therapists included 30 minutes preparation time for us to plan the answers to the questions, and then a 1-hour session that we did at the end of the school day, starting at 3:30 on a Wednesday. Not all the additional learning needs coordinators who attended asked questions, but many told us that they appreciated hearing the questions that others asked and also the answers that we gave them. We definitely benefited from the good links that we have with our local authority. And from the 5 local authorities that the Speech and Language Therapy Service works with, over 30 additional learning needs coordinators attended the session, and the feedback was very positive. We gave suggestions of activities that could be done as part of whole class activities, with small groups, and also with individual children. We didn't answer any questions about individual children as part of the open session. Some questions were about children as part of their early years development, but others were about older children in the primary school age range. We signposted additional learning needs coordinators to other sources of information, some nationally produced, but others locally produced. We produced a written summary of the session afterwards to be sent out, so that people who couldn't be in attendance were also able to access the information. We didn't go down the route of recording the session, but this would also be an option. We provided them with information that we wanted them to know about our service, as well as answer the questions that they asked. We provided information that we wanted them to know about our service, as well as answering the questions that they asked. There is a risk that this could increase the requests to the service, but this is a way of providing information to ensure that future requests are appropriate and may also avoid the need for some requests. We ended up doing a number of these sessions, some with colleagues from occupational therapy and physiotherapy, and others from neurodevelopmental clinics. I appreciate that some services are set up to provide information in this way, but for us, this was a new way of meeting a demand from schools and to get information to them in a timely way with a relatively small commitment from the speech and language therapy service. I'm very willing to answer questions that you might have about what we did and also talk about how it could work for other services. Thank you.
Thanks so much, because I'm just aware of time. Do we need to move on to the next video then, Jazz? Is that okay?
Hi, we're Sarah Morris and Amy Green, and we're both NHS speech and language therapists. We've been working collaboratively with our local council over the past few years to develop the outreach project for preschool and school settings in the Wychavon district of Worcestershire. This came about through the Social Mobility Index in 2017, which identified Wychavon as being the third worst performing local authority for overall social mobility outcomes, but also identified a particular area of need in early years. So we applied for some funding through the Social Mobility Grant to support general language acquisition in our settings in Wychavon. So we came up with a couple of overall project aims. Our first one for all settings to have a consistent and evidence-based approach to supporting SLCN. We also wanted them all using the same universal assessment tool to ensure that children were identified at the earliest stage possible and that the correct level of intervention was put in at that point. And we wanted experts within our settings who had good knowledge of SLCN to disseminate to other staff members and could also deliver targeted intervention. So we've got 43 settings currently involved in our project, and we offer this out to all settings in the local area, regardless of pupil premium numbers, but we have managed to target lots of our high need settings captured through the balance system data, which our NHS Trust is commissioned based upon.
Okay, so for the first year of the project, what we did was we approached 30 settings and we offered them a number of different things throughout the year. So they had virtual training on identification of SLCN. We provided them with their own welcome assessment as well as a speech sound identification tool that Sarah and I devised. We then went around the settings and we did a communication friendly environmental audit and then provided the settings with any extra resources that they didn't already have up, so that then they could use those at a universal level. We also then provided them with an opportunity for an individual caseload discussion. So once all of the settings had done their initial welcome, we then offered them the chance to talk with either Sarah and I and talk through the outcomes of their welcome data and obviously decide whether or not they needed to make any referrals across to our NHS speech and language therapy service. And obviously, as Sarah and I both work in the NHS service, we know which types of children would be appropriate. And what it meant was that lots of those referrals then were all appropriate, really, and all of those children then got through to our NHS service. We also offered bespoke YouTube videos to support the training that we provided them with and the resource and intervention packs that we gave them. So we provided them with 3 evidence-based interventions focusing on teaching children to listen, developing language skills and supporting speech sounds as well. And then obviously all of the resources to go alongside that, as well as the initial and final assessment rating scale that we wanted them to complete. And then at the end of the year, once they'd redone their end of welcome data, we then did a final evaluation report for individual settings, as well as an overview report across all of Wychavon, so that then settings could see whereabouts their setting lay in comparison with the average. So from that, what we found in our first year was that we actually had an additional 72 referrals made to our service just in the autumn term by schools involved in the project. And what we did was we went back and we tracked to see our referrals across the years previously. And actually that was a percentage increase of 84.6%. And as I mentioned, all of those referrals were appropriate. So they were children that did need to be known to our service, as well as preschool, as well as you can see on the table at the bottom that the referrals for preschool also went up.
And I think settings felt more confident in supporting SLCN
Absolutely.
in the meantime, while the child was waiting to be seen by a specialist.
So our outcomes of our first year, so we managed to reach 907 pupils, either in their preschool or reception year, and they were all assessed. And then what we found was that from the initial to the final welcome scores, there was an increase of 21% for those children that then scored green on their age group section, which is the average for their age. And actually that made obviously huge, so that lots of them all made huge progress. As we also found that the children that scored red, there was a significant decrease by 14%. So again, lots of those children were then either known to the Speech and Language Therapy Service if they weren't already, and were obviously getting the support that they needed ready for when their final assessment came around. One of the big things that we found actually was that pupil premium children now score in line with the average for the Wychavon population, and actually they made greater than average progress during this academic year, which obviously were the children that we were really trying to target. Other data that we also managed to capture along the way, so we looked obviously at pupil premium children, but we also looked at children on the SEN register and also children learning English as an additional language, because as we know, Wychavon have quite a high proportion of children learning English as an additional language. So again, we wanted to try and capture that really and really try and include that in our final data. There was an increase in number of resources displayed in the classroom following our audit. Staff knowledge and confidence went up following all of the training that we provided them with, and also the children that were included in intervention groups also scored a lot higher from their baseline to their outcome scores.
So we're now in our second year of the project, and this year we've had 1,217 pupils assessed using the Welcome tool. We now have a control group where we've been in and assessed them using the Welcome, and we're going to be monitoring their progress against our Wychavon population. We've had 15 additional settings during our project, and they're accessing what Amy's described earlier as our first year of the cycle. So they've had their Welcome assessment and their interventions that they've been doing. And we also had 28 of our original 30 settings stay with us for another year, which is brilliant. And this year they've continued to use the Welcome to baseline and review their children's progress and obviously inform referrals into our service. But we've also been in and demonstrated whole class vocabulary teaching strategies in their settings and provided them with their own resource packs to continue that at universal and targeted levels. We've also worked with 4 of our original settings and provided them with a primary Welcome assessment, and they're going to continue to screen and review the original cohort of reception children. So they followed them up into year 1, and we're hoping that we'll be able to track their progress through time to ensure that progress has been maintained throughout their years in primary school. As part of our project, we also have a bit of an offshoot called Communication Champion, which is available to all preschool settings in Wychavon, so not just those part of our project. And this builds upon the success of our NHS service communication TA scheme, which has been around for a number of years. So what we've been providing is termly training on a variety of topics. This started out being delivered virtually because of COVID. We've stuck with this because it really suits the large geographical area of Wychavon that we're trying to cover. We've had an average of 62 staff members on each of our training sessions, and we've now reached over 42 different preschool settings. And what we've done is track obviously staff knowledge and confidence at the beginning and end of each of our training and seen improved scores after each training was delivered.
Okay, so just thinking about the project as a whole, at the moment, things that we found that have been a success of the project. So obviously in total now we've managed to reach out to 2,124 children, and they've all benefited from inclusion within the project. We've had improved Welcome scores across the board for both of the years that we've been doing the project, and actually what that now means is that we've got additional funding for another year, which is great. The Communication Champion scheme that Sarah just mentioned is actually now being taken on by the NHS service because we found it to be a huge success, and we had lots of preschool settings across the county, not just in Wychavon, that wanted to access this training, so we are now providing it across the county. The project was also used as a template to inform the COVID catch-up funding that we've managed to have within the NHS service, which means that lots of schools that now access the COVID catch-up can also benefit from some of the things that we found useful. And also the SLCM profile has been raised through a local media campaign.
We also had some challenges along the way. So one of our main ones has been demonstrating the link between our brilliant Welcome data and general EYFS outcomes, because no national data has been published during COVID. And we've had difficulties identifying families that are pupil premium, particularly in early years. What we've really found is that we've needed to do a lot of training for staff around interpreting what a red score means and making sure that those referrals into our NHS service are appropriate, and that obviously they're supporting children in the meantime while they're waiting for specialist support. If anyone's got any further questions after this training, please feel free to email either Amy or myself on the email addresses here.
So that was Sarah Morris and Amy Green, who were speech therapists at Worcestershire NHS Speech Language Therapy Service, and the full video is available, so you'll be able to watch it afterwards. As I said, this was really an opportunity for you to hear from members who've done things in a different way to share some of their ideas. We're very keen to move you into the next workshop, because whilst we've been talking about the challenges, what's really, really important now is to think about the solutions to meet those challenges. So if you could again choose the workout group, the breakout group you want to go to. If you want to go back to the one you were in earlier, then that's absolutely fine. If you want to choose something else, that's fine too. But it's very much, as I said, focusing on what we're going to do in terms of solutions. So Jazz, are we going to go back to the opportunity for people to choose when they see it pop up?
Yes, so I'm just going to open up the breakout rooms, and you should automatically see that you're in the same room.
Yeah.
If not, just let me know.
Ah, brilliant. Thank you. Great. I think what was really interesting in our group was it was actually quite hard to find solutions, because it just shows how every area seems to be challenged. So while we might want to look to our settings, that they are, education, for example, is also challenged. So from our group, we identified that there's maybe something that colleagues would like us to do as RCSLT to support how people might approach meeting needs. And I think one of the things we'd like to do is probably collate examples of what people are doing to help meet demands, particularly to support the capacity development within different settings, and the targeted offer is what I was picking up. I think the main message though was that this is tricky, because the staffing within settings is very mobile, and so it's quite hard to get that stability. But we will take things forward from what you've said. I don't know if group 2 who are looking at the same thing, Pippa, do you want to come back into?
Thank you, Kamini. Yes, lots of talk in our group about family initiated reviews and that responsibility, but also bearing in mind that that might not work for all families if they're vulnerable in some ways, having to do that. Amit posed a very, very helpful question about our specialist work and how many opportunities for learning a child gets within a session. I think I'm right in saying, Amit, you quoted something about having the opportunity to hear and try something 75 times, and so thinking about that as part of our dosage. I think a lot of the talk was about services around speech and language therapy, but so that was very helpful to pose that question from a specialist level work.
Thank you. Room 3.
Yes, we had a great discussion, lots of amazing ideas about what we could be doing. There's a real emphasis. This is about workforce, about the importance of staff having public health skills and development. Some great out-of-the-box ideas about offering virtual roles, solely virtual roles within services, the importance of lobbying and doing a big push to track people to the NHS, because we're not really citing the benefits of working in the NHS, and that could be a pull where people are leaving and that impacts on the workforce. Really important to raise awareness of who we are and what we do. And that idea of asking people to sign up to work in the public sector for a period of time, similar to the Welsh model, but perhaps even across the UK, might be an idea. Thank you.
Thanks very much. So room 4.
Yep, so I'm going to feedback for room 4. One of the things, we kind of echo what room 3 said as well, because our area was also workforce. One thing that we as a service have also introduced is a practice development therapist. So a band 7 therapist who oversees our speech and language, OT and physio, looking at our recruitment, our support for staff when they're in-house, access to training, ensuring that all our staff have access to clinical supervision. But it's really somebody who can kind of oversee that recruitment and staff retention drive. So making links with universities, making links with local college, but having that one person who can kind of lead on that, because I think us as team needs, you know, there's so much for us to kind of be involved in, that it's bringing that consistency to us as a service and having that one person who can really have their time to focus on all the different things that the trust offers, the local area offers, around making those links, attracting staff and retaining staff at the same time.
Thank you. Room 5.
Hi, yeah, that's me. I'll just give a few points. So some of the things for solutions in terms of complexity of needs were working with others such as Senkos to understand the needs of the cohorts in the settings that they're working in, engaging with parents as well. And there was, I think, some inspiration from some of the presentations earlier, but making sure that there's clarity over what the service offer is, and the education options available for people with children as well, especially with some stigma attached to special schools, for example, within certain communities. And also within that, ensuring we engage with homeschool parents of homeschooled children too, upskilling other professions in areas where there's been an increase, such as selective mutism, reviewing care pathways to ensure that there's equity of access. I think those are some of the key points, but we did have quite a lot of other solutions on our Jamboard as well.
Thank you, that's great. Room 6.
Hi there, I'm feeding back for this one. We were encouraged by all the presentations of solutions, and we kind of felt that we all had bits of this going on. It was just capacity to be able to kind of really drive each of them forward, but that was encouraging to feel that we were kind of doing similar kind of things. The conversation we had was around kind of the sharing of the responsibility of the need with the wider system, and how we support that, how we really kind of get behind that speech and language communication needs is everyone's responsibility, and supporting that kind of whole school approach, and different ideas around that, from kind of link therapy models to more kind of cluster therapy models where capacity may not be able to individually with each school, to kind of more county-wide kind of advice sessions, and different training offers that were being looked at, that training jointly with the LA, and about kind of that all staff need to access like a mandated kind of training kind of portfolio of kind of what every school or setting should be accessing. I probably haven't given that full justice.
I think that's been really helpful, because that touches on what our group was looking at, and I think people were getting a bit stuck, and I guess it is the bit that everybody's got little bits of the jigsaw puzzle, but how do we help you pull all of this together, and the threads that maybe after this event we'll be able to help with. So should I go to room, is it room 6 next? Am I on the right track? Have I missed anyone?
I think it's room 7, which is...
Okay, that's you, yeah.
So staff wellbeing and resilience, although we kicked off talking about the first wellbeing issue, which was around workload and exhaustion, so did link to some things that other colleagues have said. We were thinking about ways, inspired by what Forth Valley said, of ethically and appropriately managing workload and caseload, and the ways that we can advocate and spread that best practice. And then people were also talking about things like the use of preceptorship, the use of return to practice, where there have been issues with new graduate recruitment, models like that. The second area we touched on briefly was that while there were plenty of wellbeing initiatives, because of the feelings of overwhelmedness, people aren't in a space where they feel able to do it. Actually, the consensus was that a return to more face-to-face and a return to more direct social interaction will be part of the solution to getting people into a space where they can feel able to receive wellbeing support.
Thank you for that. So I think it's been so I think it's been an interesting journey. Sorry, I'm just looking at what's happening in the chat box. So if we what we're going to do next is really just to help pull together your ideas, both the challenges that you've identified and the solutions, those from the speakers and what you've said during the workshops. But I'm very keen to hear what you also think we need to be doing next. So I'm just making sure that we move on to the next step slide. So I just want to remind you of the resources that are on the website. In the webinars that are listed here, there's a lot in there about co-production. So for those of you who are talking about how do we do co-production with families, there were some examples of how that might happen and what you might do. And the document placing children and young people at the heart of delivering quality speech language therapy is all about co-producing outcomes that matter most. So please do have a look at that if you haven't seen that before. I've asked Rebecca to post in the chat box the event that's coming up. I mentioned in our group we've already got 370 registrants for the event on measuring outcomes, which does include measuring outcomes when you're providing universal and targeted care. Please do look at the other documents that are here and reference points. So I just want to recommend those to you as part of your next steps, I guess, when you're when you've left this event. If we go to the next slide. So as I said, there were some of you who were offering ideas, and we will come back to you. I hope that's okay. So people certainly in my group who were saying, yes, we've done X, you know, we'll come back to you to help with pulling together some of the ideas that you were happy to share with colleagues. We've got a briefing on the impact of COVID-19 on prevalence and the impact on speech language communication. If that helps you to make a business case locally, that might support you with some of your funding proposals. One of the people in our group was talking about applying for funding to help capacity development, not just within the speech therapy team, but within schools, which I think is really an interesting concept. So if you could share that with us, I'd be very grateful. But it would be good now just to see if anybody's got any other ideas about what you think would be helpful for us to do together. Really, how else can we support you? What would you like to see that would be helpful? Because we know this is the start of a journey and this is a big area. Okay, there's something about how we support independent therapists. Yeah, so we're already talking with ASLTIP, and in fact I supported them to get a speaker at their conference on how they're working with the NHS. And these were speech therapists who had originally worked in the NHS and now set up their own community interest company. So I think this is something that we do want to do, is have these conversations with the profession as a whole, because it's the fact we're all in it together. How do we create the change we want to see? Because we're all in it together for the good of the children and young people, but whose needs we want to meet. So if you're happy, that's something that we would be very keen to pursue as well, is how we act proactively and constructively work with other sectors. So somebody's asked, we're planning another event for adult services. It's something we have discussed, and if you think that's important, that would be helpful. There is CPD funding for SLT training. We'll pull down all your chat box requests, and we can come back to you from after the meeting. Anything else? So we've said that we'll pull together the ideas. Is there anything else that how else would you like to connect with each other? We can set up a professional network site. A site on the website will allow us to set up a sort of community of practice if you want to work together, if that would be helpful. So yeah, I don't know if it'd be a hub page, but because this would be something that would be UK wide. Is that okay? But we can have a think about that. Would people like that as a potential option? But one of the things we found when we've set up these areas is that nobody then uses them. So you need to go in and post a question or raise an issue. So, you know, it's really important that you actively engage, but we can have a go at that. Yeah, so people are saying yes, because I think that's the thing, is to start populating it with, I have an issue and other people's talk about solutions and sharing them. Yeah. Okay. Any other ideas? Any colleagues on the call from RCSLT want to come in at this point? Some things you've picked up. Don't know if Amit's still on the call. Have you got any ideas, Amit?
I was wondering if people had posted about the sort of developing practices between independent and NHS services, and I know that one of it was worth mentioning, the Sender has been thinking about this area.
Okay, yeah. Anything else from anyone else? Glenn, Pippa, Caroline, Derek, Glenn?
I think we... Sorry, Derek.
I suppose, Cammy, I think that we're partly undertaking this because we've had concerns that some emergency measures are being taken around waiting lists which aren't ethical. I guess it would be good if we can say, here's some things you can do. Here's some approaches you can take to try and, based on what colleagues have told us, here's some things that have worked elsewhere that you might be able to apply where you are.
Yeah. Louisa, did you want to come in? And Glenn, sorry, you were next.
Yeah, it was related to what Derek said. It'd be good to try and make sure that the momentum keeps going from this event, and we capture some of the fantastic ideas people have shared and get it back out to them, because as you said, there's lots of really good bits of the puzzle that we need to communicate. So if we can theme some of those ideas on the Jamboard, I think that'll be helpful.
Okay. Right, so before you go, just to remind you of the evaluation, and Rebecca's put it in the chat box, so we'd like to get some feedback. I think we're very aware that this is just the start of a journey. As we've said, that we want to support you as we recognise that the challenges are significant and they're multifaceted. So we will have a debrief as an within the team. If colleagues could actually stay on the call for a few minutes, we can just have a think of what we might need to do and how we go forward. I'd be very grateful if you could do that. Thank you. But I just want to say a big thanks to everybody and for your input and your insights and for your honesty. We know it's a really challenging time, and it's really important that we support each other as a profession. So thank you so much to all of you. And Jasmine's just posted that everything will be posted on the website in terms of the presentations too. Thanks for contributing, and we'll be in touch. So see you soon. Thanks a lot. Take care, everyone. All the best.